Can I just remind members that further on the agenda we have a number of what are called closed questions about specific geographic areas, and I will try and keep it to the geographic areas if I possibly can. Question 2, Julie Morgan.
Thank you, Presiding Officer. Last week I visited the Haemophilia unit in the Heath Hospital in my constituency of Cardiff North, and following discussions with the consultants and patients there...
Can you ask your the main question?
Oh, sorry, yeah.
Sorry,
what plans does the First Minister have to improve services in Wales for patients suffering from haemophilia?
Thank you.
Well, in November of last year, the Minister for Health and Social Services published a report containing a number of recommendations on improving services for people with inherited bleeding disorders, and additional funding of £96,369 has been provided on a recurrent basis to support counselling services for those with inherited bleeding disorders.
Thank you for that response. And I visited the haemophilia unit in the Heath last week, and after discussion with the consultant and patients, I learned how important it was for physiotherapy. And certainly I understand there is only one specialist physiotherapist for haemophiliac patients in Wales. What can the First Minister do to improve access to physiotherapy for haemophiliac patients?
Well, we want to ensure, of course, that there are adequate services and good services available to those who suffer from haemophilia. I know that LHBs are currently going through looking at service redesign. Members will know that, and that should provide an opportunity, of course, for some of the issues that have been raised to be addressed.
Darren Millar.
Presiding Officer. First Minister, some patients suffering from severe bleeding disorders like haemophilia live in rural parts of Wales, including in North Wales, where, due to the very rural landscape, travelling regularly to treatment centres can be quite prohibitive and difficult. The Ministerial Task and Finish Group report on haemophilia services in 2011 found that many rural patients prefer to be managed locally where possible, rather than travelling some significant distance for specialist care. Will you outline to me what your government is doing to ensure that there is local access to services, particularly against the backdrop of your significant cuts to the health budget?
Well, again, here we go from the party opposite. They seem to be immune to what's happening over the border and all the trouble over there, but there we are. In terms of where we are in Wales, we will always seek to ensure that a service can be delivered as locally as possible, provided that it's safe.
Lindsay Whittle.
First Minister, can you state what levels of payment have been made to haemophiliacs as a result of compensation for receiving contaminated blood? And is there a waiting list, please, of patients waiting for this?
Well, no. I mean, we look to provide compensation where that is appropriate, and it's important to note, of course, that in terms of compensation, you will know that on the 14th of October, the UK government announced it would review the support available to individuals infected with Hep C and or HIV by NHS-supplied blood transfusions. In March of last year, the then Health Minister agreed to implement in Wales a number of the recommendations that were made by the review, and those recommendations have been taken forward.
Vaughan Gething.
Thank you, Presiding Officer. I recently met with a constituent of mine, a Mr Thomas, who is one of thousands of haemophiliacs affected by the contaminated blood scandal. This has obviously had a devastating impact on many families across Wales and the rest of the UK. Can I ask whether the Welsh Government will raise this matter with counterparts in devolved governments and the UK Government to review the current position with regard to treatment, especially in the light of the Penrose inquiry currently ongoing in Scotland?
We will always, of course, look to see how treatment can be improved and how people can have their conditions either properly managed or indeed cured in years to come. That, of course, is something that was done when we looked at how best to help those people who had suffered as a result of contaminated blood products.